It's official. New Jersey has joined the growing roster of states that have confirmed swine flu cases. State health officials have confirmed 5 cases here. All involve people who have traveled recently to Mexico or California. Health and medical correspondent Sarah Lee Kessler has just returned from a news conference and joins us now with more. Sarah Lee?
Adrian, New Jersey has become the 17th state in which H1N1 or swine flu has been officially confirmed. The 5 New Jersey cases are in Bergen, Monmouth, and Burlington counties. Burlington has 3 of the 5, all in the same family. Patients range in age from 10 to 47. We're told the confirmed cases have been mild. All 5 patients are recovering at home. No one has been sick enough to be hospitalized.
I think all of us carry reasonable concern about this issue, but we're certainly not in the alarm stage.
The governor spoke from the state's Health Command Center this afternoon, flanked by health officials and the directors of both the state police and Homeland Security. They urged the public not to overreact.
New Jersey residents should continue to go about their daily routines. Children should go to school, and people should go to work.
State officials told news reporters that 4 of the patients had recently traveled to Mexico, the epicenter of this global flu outbreak. The 5th had traveled to California, one of 17 states so far, including New Jersey, with confirmed H1N1 cases.
All 5 individuals had mild cases of H1N1 influenza. I'm pleased to report that none were hospitalized and all are recovering well at home. It is important to note that the cases are scattered throughout the state, as I mentioned, which indicates that we do not have a cluster. Also, schools are not involved because, as I said earlier, the children did not attend school before getting sick and have not returned since.
President Obama has rejected proposals to close our border with Mexico.
It would be akin to closing the barn door after the horses are out, because we already have cases here in the United States.
What we are in is the proactive surveillance and monitoring effort, one that we have planned for.
New Jersey has launched a stepped-up monitoring program involving hospitals and doctors statewide.
As we know, history being prologue, in cases like this, sometimes the second wave of the influenza is more hazardous.
The state has stockpiled more than 1 million courses of Tamiflu, an antiviral drug that, if taken within a day or so of the onset of symptoms, can reduce both the duration and severity of the illness.
The typical symptoms that we've been seeing in confirmed cases of influenza A H1N1 are fever, cough. Some individuals are presenting with shortness of breath, they're presenting with headaches, with, the typical symptoms that you see in influenza.
Meanwhile, Vice President Joe Biden stirred controversy earlier today after he said, in light of the flu epidemic, he would avoid airplanes and subways.
I would tell members of my family, and I have, I wouldn't go anywhere in confined places now.
State Health Commissioner Howard's reaction?
If you are sick, stay home, but if you are not sick, go on and lead your life as you normally would.
2 more probable H1N1 flu cases were identified in New Jersey yesterday, but the state is still awaiting CDC test results on those. A reminder for you, if you have questions or any concerns about swine flu, health educators are standing by 24 hours a day here in New Jersey. The state has established a toll-free hotline. The number is 1-866-321-9571. Adrian?
Thanks for monitoring this changing situation for us, Sarah Lee.